Welcome back to the Mom and Mind podcast. I'm your host, perinatal psychologist Dr. Kat. On this episode today, I'm talking with Dr. Nikki Panczak. She's sharing her new book, Rattled: How to Calm New Mom Anxiety with the Power of the Postpartum Brain. She's a clinical psychologist specializing in perinatal mental health and provides evidence-based therapy to her patients. She also serves on the Expert Review Board for Parents Magazine, Expert Board of Providers for Mother Untitled, and is a TEDx speaker. She shares a little bit about her personal experience and what inspired her to write the book Rattled. So let's meet Dr. Nikki Panczak. Welcome, Dr. Nikki. Thank you so much for being with us.
Thanks for having me, Dr. Kat.
I'm really excited for you to tell us about your new book, Rattled. And before we get into that, I would love to hear a little bit about how you came to this specialty and came to be helping the people that you help.
So, I'm a clinical psychologist, and throughout my career, I specialized in working with patients with advanced medical illnesses, such as cancer. But then over time, I became fascinated with a different type of patient, the silent patient, the caregiver in the room. And so, in my academic career and working in medical centers, I built a program of research centered around caregivers and helping them cope with anxiety, stress, depression, because we know with the stress of caregiving, a lot of times caregivers experience their own depression and anxiety as a result. So, fast forward, I'm in my academic career and I basically became a mother. And then I realized this aha moment where mothers are caregivers as well. They're the ultimate caregiver. And we have a lack of resources for mothers. There's the maternal mental health crisis and um, a lot that goes into it. And I just don't think we do a good job of preparing mothers for early motherhood. And so I translated all of that caregiver knowledge to working with the different type of caregiver, the mother. And then I also went through postpartum twice myself personally. I'm a mom of two. Now my kids are 4 and 6. So, I've been on the other side of the postpartum journey and the trauma for quite some time. And for me, hindsight was 2020 after, well, I actually wrote the book during the COVID pandemic after I
Mm-hmm.
had gotten to the other side. And I realized that there are it's an incredible opportunity to inform mothers and make the most of this postpartum period. And I wanted to better prepare mothers based on my hindsight, the science, working with my own patients, my specialty in working with mothers and postpartum, as well as caregivers.
Great, fantastic. So, right, you're coming at this from several angles,
Right.
so in the research on caregivers, I'm sure, like you said, you touched on, you learned quite a bit. Can you say more about the silent caregiver and how that kind of shaped or informed
Mhm.
um, parts of your book?
Right. So, I mean, working with medical patients in the room, the caregivers are the silent patients, right? Everyone's focused on the patient and keeping the patient alive and improving the patient's quality of life. But no one's really asking the caregiver how they're doing. But the caregiver is involved in, a ton of instrumental tasks to help take care of the caregiver. And specifically for me, I worked with caregivers of patients with stem cell transplant.
Mm-hmm.
And the period where caregivers have to take care of those patients, the first 100 days, the patient is incredibly vulnerable.
Right.
Basically, their immune system is broken down, and the caregiver is really responsible for keeping the patient alive in so many ways. And so I really saw the parallels when I
Yeah.
became a mother, and I realized, okay, we focus all this attention on the babies
Mm-hmm.
and milestones and
Right.
setting and pregnancy and
Sure.
monitoring the baby, before, during, and after.
Right.
But who's paying attention to the mother? The
Mm-hmm.
mother is the silent patient. So I
Mm-hmm.
really felt like, wow, we need these resources as well.
Absolutely.
Mhm.
That is so very true. And I think it speaks to how isolated and alone and silenced new moms and new parents feel in this journey. There's an awful lot of focus on the baby, which is great. Of course, there's a new human and they need our care and attention. But to your point, gosh, the caregivers in general, but moms in particular, are just in go mode. They're just like
Exactly.
constantly attending to needs and details of things. And if they other people might not be attending to them, and also like they have a hard time attending to themselves because they don't have that support.
Well, not to mention their brain is actually working against them
Mm,
to attend to the baby, right? Your
yeah.
brain goes through all of these changes to focus on caregiving, right? And
Hmm.
so I'm saying, wow, this is an opportunity where it's all new learning. The maternal brain is in this neuroplastic period where there's an incredible opportunity not only to teach parents and mothers to take care of their babies and how to do that, but to integrate how to take care of yourselves, right? And so that's really where I'm coming from, teaching mothers how to really optimally care for themselves. And we can get into the specifics of that. But yeah.
Yeah, let's do that. I know your book is filled with a lot of good stuff. So, yeah, tell us a little bit about, what the book holds.
So basically, motherhood is not working in the US. Okay. We have a postpartum mental health crisis. And so I'm coming at motherhood to try to revolutionize the way that we help mothers navigate and adapt to this process. And I really focus on three pillars in the book. And the three pillars are the first and foremost is postpartum treatment and postpartum mental health. Because if you don't have solid postpartum mental health and treatment, then you can't really make use of the other pillars that I'm going to talk about. The second pillar is matrescence and basically helping mothers understand that, researchers at Yale have now deemed that this is a neurocognitive developmental phase, becoming a mother. It's a
Right.
big deal. There are
Yep.
seismic changes to everything, every system in your body. Your identity changes, your brain changes, your hormones, your roles, your relationships, your emotional experiences. I mean, everything changes. And so, how do we navigate that? And how do we think about this in a way that's productive and healthy and to better support mothers through this process? And
Hmm.
then the third pillar that I talk about is the power of the maternal brain. So, everyone's familiar with the derogatory term mom brain, right? When
Hmm.
a mom makes a mistake or has a lapse in memory, it's
Hmm.
viewed as a deficit or dysfunction. But if we really look at the research, that couldn't be further from the truth, and it's such a small part, right? So we're actually learning more about the cognitive boost that can come from becoming a mother and the power of this mom brain. And the picture is excellent, and I think mommy brain really needs to be turned on its head,
Hmm.
right? And so let's empower mothers to understand the power they're working with under the hood. And specifically, I go into things like post traumatic growth, right? Because we know that we can't really talk about motherhood without talking about trauma.
Right.
Birth trauma occurs in 13% of mothers. Motherhood is a normative trauma in general. So, just the complete overhaul of every system in a short period of time.
Yep.
COVID was a global trauma. Mothers that had their first babies during COVID are now having their second babies and re-experiencing all of this due to that unprocessed trauma.
Hmm.
Uh, 1 in 3 women will experience a sexual assault. There's the motherhood wound, which also brings up core trauma.
Sure
I mean, I
does.
think
Yep.
that there's just so much opportunity here. Let's have discussions about trauma and post traumatic growth and how to get mothers to the other side. It's an opportunity, a lost opportunity, I feel. And then the other thing I talk about is self directed neuroplasticity with the power of the postpartum brain, postpartum brain, and these maternal neuroplastic processes, right? So, like I mentioned before, it's sort of like this wave of neuroplasticity that's happening, and I'm just like trying to infuse mothers to help this process go right. And what are the healthy ways that we can increase neuroplasticity in a productive way, right? So, postpartum mental health treatment, we know that therapy rewires the brain,
Hmm.
plus all of these other strategies that are based on, cognitive behavioral therapy, evidence based approaches for navigating this time. So,
Sure. Yeah, it's fantastic. I mean, all of those are necessary things to discuss. And for people who aren't familiar with the term neuroplasticity, can you describe a little bit about what that is? Just, for the person at home listening who's wants to know how their brains are being affected.
sure. So, when um, a woman becomes a mother, the brain changes rapidly. It fine tunes and primes itself for new learning. There's all these new neural networks that are being formed. based on your experiences with your baby. And so the environment and the relationship with the baby actually changes and builds those networks, right? You've never
Mhm.
changed diapers before. You're building a whole neural network around that, right?
Mhm.
So it can
Mhm.
be very small things to very big things. Like, wow, I've never thought about the way I would like to mother and parent. That's a huge thing. So you can see
Yeah.
like tons of opportunity for those neural networks to form. And then also the brain goes through something called synaptic pruning. It's basically shedding useless neural networks, right,
Mhm.
that are not needed. So
Mm.
that's probably what's going on in terms of the derogatory mom brain. It's the increased mental load and the adaptation to all these new responsibilities and
Mhm.
this flourishing of neural networks being formed, right?
Mhm.
And
Right.
so some of those other things that you're not thinking about to care to tend to the baby are now being discarded because they're not being used. So
Yeah.
I always say it's like Marie Kondoing your mind to give moms a leg up in caregiving. It's
Uh-huh.
reorganizing and everything. So
Mhm.
it's a remodeling process.
Right. That's thank you for that explanation. I think it is really helpful for people to understand that this is a physiological
Mm,
manifestation of a transition. Everything is changing. You're yes, changing, transitioning into parenthood, but your brain is transitioning into it too. And in particular, because you know this very well, it's not like people are sitting there thinking, well, okay, my brain is changing and that's why this feels different and that's why I'm having a hard time over here. It
mhm,
turns into what's wrong with me, why can't I, and you know, all these sort of self-inflicted wounds that are societally impacting us too. It's not just us making it up.
mhm.
But this, like, I always think that being able to hold on to, like, there's something actually happening. It's not just like a quote unquote you problem, is so empowering.
100%. And there's this whole culture of mother martyrdom out there where
Mm-hmm.
mothers feel like suffering should just be part of becoming a mother. I mean, not because it comes from themselves. Like you said, society is really portraying that image, right? The
Mm-hmm.
greater the sacrifice, the better the mother. I mean, it's ridiculous.
Right.
And so when mothers are suffering, they do think that it's something's wrong with them. And especially with postpartum, I mean,
Yeah.
even though we know the rates are 1 in 5, it's a gross underestimate.
Mm-hmm.
Mothers are afraid to report their symptoms because of fear that they'll be viewed as unfit or that their babies will be taken away or motherhood is not, they're not cut out for motherhood when that's not true either. And so I'm really trying to validate the process and help mothers speak to themselves with compassion and empower them to understand no, this is a huge transformation. You got to give yourself some time to
Mm-hmm.
sort of to adapt.
Mm-hmm. I think too that it also can help, like getting having that information to your point can help them, help moms feel empowered to also, I don't know how else to say it, but like set limits or boundaries, or if somebody's telling them that they should, you know, quote unquote, be doing better or be feeling better already, whatever that means,
Right.
that there's some science for people to hold on to and say, well, actually, I'm in this process, and it's not just that I can snap out of this.
Exactly, right? And if
Yeah.
you're resting, doing nothing, you're not doing nothing. Imagine your brain is synaptic pruning, right?
Hmm.
Or building
Hmm.
new neuroplastic networks, and you're just, you're letting that happen and speak to yourself the way you would a friend, right?
Hmm.
With
Yeah.
compassion.
Yeah, absolutely. I love the title, Rattled, and I have my own associations with why I think that's great. But for you, what brought you to that title?
Well, I think it was obviously the play on words, right, with the baby rattle
Hmm.
and then feeling also rattled by motherhood, right? It shook
Yeah.
me to my core. And so I wanted to really emphasize that and have sort of a one word for that to try to capture that.
Yeah, I think it does really fit a lot of people's experiences. It just does kind of shake you up
Right?
in a lot of ways.
Hmm. Absolutely.
So in your book, I want to get into a couple of more specifics about the things that you talk about that I think people would really resonate with. Can you talk a little more about guilt and shame as it shows up in new motherhood?
Absolutely. I mean, what mom doesn't feel mom guilt? I have a whole chapter on it. I have a whole chapter on mom shame. And
Mm-hmm.
so mom guilt is I did something bad versus mom shame is I am bad, more of a core belief. And I have very different approaches for each. And so with mom guilt, as a clinical psychologist like you, I sort of look at this in a way that's more diagnostic, right? So with the mom guilt, I'm looking at how bad does it get? How often are you experiencing it? And does it actually impact behavior? And the reason being is that guilt is related to depression, right? The more depressed you feel, the more mom guilt you're going to have. And also vice versa. The more mom guilt you're going to have can actually make you feel more depressed, right?
Sure.
So it's a
Yep.
vicious cycle. So we want to tackle it from all angles. And so when I think about mom guilt, I have a very specific strategy that I think is like really works with a lot of my patients. It's based on cognitive behavioral therapy approaches, and it's called the double down method. And
Mm-hmm.
I'll leave it at that because I think the readers would really love to get a more detailed um, plan on how to approach that.
Mm-hmm.
But it's really important to talk about mom guilt, right? Because every mother experiences it, and just know that there's a really great way to handle that.
Yeah, it's not, the felt sense of guilt is hard to, I guess, conceptualize for yourself when you're feeling it as
Mhm.
part of something, part of depression, part of transition, part of societal pressures, whatever. Again, it kind of goes back to I'm doing something wrong.
Right, right.
um, and to be able to hold on to that, there's a tool that can help
Mhm.
you get
Mhm.
out of that, or at least not fall more deeply into it, is so important, because it
Right.
makes it a thing, not about a quality of who you are.
Oh, exactly. And it's also on a continuum, right?
Mm,
So, like, it's not like we can get rid of mom guilt completely. Ambivalence is the hallmark of motherhood. We're going to have that push pull, when we're away from our kids and when we're with them, right? And
mhm.
so to sort of validate and normalize that, but also we have plenty of room to work with the mom guilt. There's way too much mom guilt happening.
Oh, yeah, for sure. Plenty to talk about and unfortunately go around. Yeah, and people are feeling it deeply. Yeah, I know you talk about many things in the book. What are some of the other concepts that you touch on?
I talk about mom shame, mom rage, baby bonding, relationship changes. I like to really talk about that because we know that relationship satisfaction plummets in early parenthood. And I just want to validate that for everyone. If you're
Hmm.
not in your best life as a couple when
Hmm.
you first have a baby, that's pretty typical. But I also talk about how to navigate that as well. I talk about back to work transitions. I talk about matrescence in general and all the seismic changes that go on to that. I talk a bit about brain changes, but in a sort of engaging way,
Hmm.
right? So I'm not, you know, I know I'm an academic researcher, but my goal was to really translate the science in an approachable, readable, engaging, entertaining way. And so I weave in a lot of personal narrative, what I went through, some anecdotes, and then also clinical examples from my practice. But it's all meant to be sort of a personal narrative storyline with science weaved in. Um, Throughout, right? I really wanted to parse out what's really important. I mean, we're in the age of information overload with social media, and it's like, what do we pay attention to? What don't we? So I wanted to do the heavy lifting with that and
Yeah.
talk about what is the state of the science? What really do we need to think about when becoming a mother and in this early motherhood phase?
Hmm. That's great. I mean, it's right. Just the things that you're describing that you touch on in the book are so just touch on how many facets there are to this transition, and to what it means to become mother, and specifically, there's a lot of forces upon us, from the outside, but also stuff that comes up internally that we're, you know, thinking about or struggling with, and having a book like yours where you can see yourself in it
Mhm.
and know that it's not just you is really, really empowering.
Absolutely. And, I wanted to create a book that was meant to be a thought partner, a companion to sit on your nightstand. I made the cover pretty because I wanted to be something that mothers would be okay looking at. And also, I have these snapshot boxes in the book where they're sort of summary boxes that are tips and tricks, and it sort of gives the practical guidelines or the practical things that I speak about in bits and pieces
Hmm.
so that mothers, they're in the middle of the night up and they just like can flip to a page and look at their snapshot boxes to review something. And also, I encourage the readers to go through the book and take pictures of the snapshot boxes and create an album in your phone. And you can call it whatever you want. You can call it Rattled, you can call it This Is Hard, or whatever expletive you want to call it, and take pictures as you go throughout the book. And that way you have your little coping cards slash reminders of what's going on and how to work through that right on your phone so you can look at it in the bathroom when you're out, anywhere.
Sure. That's a great, great tip. And so needed. Like people need things to hold on to, a little bit of a lifeline here and there, especially if you're feeling, you know, overwhelmed and you need to feel kind of grounded somewhere.
Exactly, exactly. And that reminds me, I also talk a lot about postpartum mental health and setting up a foolproof postpartum treatment plan, right? So, um, we need to set more mothers up for success proactively. We're clearly not catching enough mothers who are suffering. And so I talk about starting postpartum, establishing care with your postpartum mental health team once you pee on that stick. Get yourself a mental health professional, a
Hmm.
therapist, and a prescriber that specializes in postpartum, whether you think you'll need it or not. Have it set up because you don't want to scramble last minute to try to find a doctor or wait 3 months for an appointment, right? And I say this, what I was able to feel better in 9 days after my postpartum crises. And that's because I had my team in place. I had established care and follow ups at the appropriate times. And also, I called my doctor from my closet crying, and she
Hmm.
called in my prescription immediately.
Hmm.
And that helped me get better very quickly. If I had to wait, first of all, I couldn't even think about how
For
to
sure.
properly or
Right.
how do I even find a therapist? In that state, when you're just really struggling and in it and in the thick of it, you can't you can't do all of that. So let's get that responsibility off mother's plate postpartum and set up the care. Unfortunately, the onus still falls on mothers to set it up themselves, but do it proactively,
Hmm.
right?
Yeah, absolutely. It's so much easier to have it set up beforehand. And
Hmm.
to your point, that really foggy state, you might think, oh, I'm going to call so and so today. And then the whole day goes by and like you were doing a million things. And that can happen day after day. So
Right.
knowing that you don't have to do all that beginning process of talking to somebody and telling them your story. But certainly, if you need to do that and that's the space you're in, do that. Get somebody to help you do that.
Sure.
But if you can do it ahead of time, it's so much better.
Absolutely. And also, it helps the doctors get a better baseline assessment of you
Hmm.
so they know what they're working with. And so, postpartum, we know that there are certain risky windows where we see post upticks in postpartum. So, after birth, if mothers aren't breastfeeding or chest feeding, the hormonal dips can be a risk factor for postpartum. And then, once the weaning process starts, so you would line up, postpartum mental health treatments around those time points and other time points based on your own personal risk factors.
Hmm.
And I would say, let's stop giving mothers checklists, right, to self diagnose.
Hmm.
Okay. They don't need one more thing to do. Let the doctors do their job, establish the postpartum appointments, and let the doctors take care of you. All you have to do is show up. The silver lining from COVID is that we have telehealth available,
Hmm.
right? And let the doctors assess you and do their job. They want to take care of you.
Sure. Yeah, I think especially if you have somebody who's perinatal mental health trained.
Mhm. Yeah.
Unfortunately, like, sometimes doctors don't get it. So making sure that you have that resource ahead of time is great. And not the doctor's fault. It's just like we're not there yet where
No,
everybody knows what
we're
to
not.
look for. Um,
Mhm.
so, like establishing that care with somebody you feel comfortable with is so, so important.
Yes, I agree. And right, when I say doctor, I mean mental health
Oh,
specialist.
for sure.
in
Yeah.
postpartum because sometimes providers don't know what they're looking at and they
Hmm.
can be dismissive just because they're not trained in postpartum
Right.
what to
Right.
look for. So you really want that postpartum specialty. Absolutely.
I know you have a TEDx talk. What was that about and how did that come about for you?
That was really exciting.
Hmm.
So I gave a TED talk on the power of the maternal brain, and what I did was I talked about, what I personally went through with postpartum and how I was completely, rocked by this process, rattled by this process, and how I came out of it. And I talked a bit about the three pillars that I talk about in the book. So the matrescence, postpartum treatment, and the power of the postpartum brain. But ultimately, what I did talk about more so in my TED talk than I did in Rattled was really how we are as mothers assets to society, to our employers, and with our brain development. There are a lot of basically skills that we're learning in early motherhood
Hmm.
that will translate to the office or to whatever work we decide to do inside and outside the home. And I really wanted to empower mothers and employers to think of this as an opportunity, as like a natural employee development program, and to think about incentivizing mothers with paid maternity leave up front so that
Hmm.
the process goes right and you can benefit from um, from providing mothers and nurturing mothers through this process. I mean, top companies like
Hmm.
Google, Microsoft, and other companies, allocate 2 to 5% of salary funds towards enhancement programs for their employees to learn leadership skills and
Hmm.
empathy and client,
Hmm.
how
Hmm.
to navigate with clients and problem solving and efficiency and all of that. And I'm like, wait a minute, all of these skills we're learning as mothers naturally, right? We're
Hmm.
navigating all of these different tasks. We have to be more efficient. We're our mental load has increased. We're problem solving. What's important? What's not? And so I really think that again, turning this mommy brain on its head and rebranding it in a way, because we know that the subjective experience of mommy brain is real, right? The
Hmm.
fogginess, forgetfulness, and
Hmm.
lapses in memory, probably due to sleep deprivation and the enhanced mental load, right? That's very real. But when we look at mothers compared to non-mothers, um, doing memory tests in the research, there's really weak support for significant differences. And so, again, I want to empower mothers. A lot of mothers feel not only guilty going back to work, but also feel like they have been out for so long, they're not an asset anymore. And I believe that really they have gained so many skills, it's not lost time. And they should really think of it as they're enhanced and think about their brain power. I mean, the capacity has just increased from all of that neuroplasticity and brain development and skill building. And so I really want to empower mothers to and companies and employers to think about that. And there are
That's,
some studies
yeah.
that early on that have shown that giving, mothers stipends actually improves. They're able to use that for resources and treatment and to reduce stress, right? And then they're
Hmm.
able to engage better with their babies. And they
Hmm.
actually showed increased brain activity in the babies because they're more engaged. They're not preoccupied. They're not bogged down by stress, right?
Hmm.
And so we
Hmm.
want to help mothers make the most of this process and get all of the benefits that they're able to. We want this process to go right because it's incredible.
Yeah, I'm all for that. That's an amazing perspective and a needed perspective paradigm shift,
Mhm.
change in companies, um, and it just highlights the kind of long-standing idea of that in some way that becoming a mother changes you so much that you won't be effective anymore,
Right.
or that you're like you've lost something, which is fairly patriarchal view of females or mothers rather, um, and the process that they go through. I'm and because of that like dynamic that's out there societally, I'm curious if you've gotten any pushback on that, or if or if you're getting mostly positive um,
I'm
responses.
getting a lot of positive, and I welcome any discussion about it. right? I would
Yeah.
love to have, a challenge to the perspective and have an open conversation. I have plenty of research to back this up, and I just really want to inform and advocate for this. So, I welcome
Yeah.
anyone to have a discussion, even if you feel negatively or have a reaction about it. Come talk to me.
Right. I'm really glad that you're open to that dialogue because it is about I mean, you have the research to back it up, and it's about having conversations and like putting a little like crack in the mentality that of that the kind of older mentality of that
Right.
women once they have kids are just sort of out to pasture.
And by the way, I should say that fathers experience brain changes as well. And we know that fathers, 1 in 10, experience postpartum depression. So it's not like I'm saying that fathers don't have an enhanced skill set as well going through early parenthood. Mothers just have more because of the biological changes, right? And I also think that the reason I'm advocating for this perspective and focusing on mothers is because there is a health disparity in research right now where only 4% of research funding goes to women's health issues, and men's health issues are known as being overfunded.
Right.
And I've never heard of anything being overfunded, but I'm just giving, I think, mothers, it's their time. It's our
Yep.
time now.
Yes.
And we need to focus. And I'm here, to really advocate for that because we need to catch up.
No, you're 1,000% right, and unfortunately, you can speak to this better than I can. Some of the ways in which treatment strategies are built for women are based on research on men, and that doesn't always translate. And
Yeah,
in some ways, is it's harmful, if I can say that.
absolutely.
Yeah.
Yeah, and I think that there's just a tremendous opportunity to do better, matrescence and maternal brain plasticity research and postpartum treatments. I mean, luckily we have great treatments available now, and we just need to get those out. But we still need more advances in the science, more research. I mean, there's just so much that we can do, and I'm
Yeah.
sure, we'll get there by the time I'm old, right? But right now I'm trying to speak to where are we, what's the state of the science, and help push that narrative forward and push that research agenda forward. I'm so thrilled about the women's health initiative put out by the White House, and I hope that the funds will go to investigate. Like, I could see doing these brain studies with mapping on all of these neural networks that are being formed, and how that translates to home, inside the home, outside the home, work. I mean, we can, and what happens when we incentivize the process. I mean, these are going to be great studies, but we don't have them yet.
Right, right. Well, understanding, about how you think about this period of time is great. It's really intriguing, and it's a good foray into kind of a newer, more modern way of thinking about motherhood and the transition into motherhood. I would love for people to know more about where they can find Rattled.
Sure. So, I mean, definitely follow me at Dr. Nikki Pensack on Instagram because I'm giving all these updates on different book events. But you can buy Rattled from any major retailer and minor. Support your local bookstores. It's on Amazon. It's on Barnes and Nobles. And yeah, that's the best way.
Thank you so much for coming on and sharing about Rattled and all of the great work you're doing. Thank you for being here.
Thanks for having me. It was a great discussion. I appreciate it.
Please find out more about Dr. Nikki Pensack at drnicoleamoyalpensack.com. And also make sure that you are subscribed or following the Mom and Mind podcast so that you get all of these episodes downloaded directly to you. I thank you so much for being here with us. Until next time.